In the near future, your body will become its own early warning system, detecting disease long before you ever feel a symptom. For decades, medicine has been defined by reaction. We wait for something to go wrong, and only then do we intervene. But biology rarely announces its intentions. Most diseases develop quietly, progressing beneath the threshold of perception until the damage is already substantial. This reactive model is the fundamental limitation of modern health care. Cancer can grow undetected for years. Cardiovascular disease advances silently until a vessel narrows enough to trigger a crisis. Neurodegenerative disorders begin altering the brain long before memory loss becomes noticeable. By the time symptoms appear, the underlying pathology is often well established. This isn't a failure of doctors, it's a failure of timing. Our tools simply haven't been able to see early enough. But that is changing. A new paradigm is emerging, one where healthcare becomes predictive rather than reactive. Instead of waiting for disease to reveal itself, we will anticipate it, model it, and prevent it with unprecedented precision. The first pillar is continuous biomarker monitoring. Advances in nanoscale sensors, non-invasive imaging, and biochemical wearables are turning the human body into a real-time data stream. These systems can track subtle fluctuations in inflammation, metabolism, cardiac stress, and even early oncogenic activity. Imagine a patch on your skin that detects the earliest molecular signals of a tumor, or a smart ring that identifies arrhythmias days before they escalate, or a routine scan that maps micro-changes in organ function with millimeter accuracy. This isn't science fiction. Prototypes already exist. The second pillar is AI-driven risk modeling. With continuous data, machine learning systems can identify patterns invisible to human clinicians. They can forecast the trajectory of disease, estimate the probability of organ failure, and simulate thousands of possible futures. Digital twins, virtual replicas of your physiology, will allow doctors to test treatments on your simulated body before applying them to your real one. They'll reveal how your heart responds to stress, how your metabolism shifts over time, and how your unique genetics influence disease risk. Medicine becomes personalized, not just to your biology, but to your future biology. The third pillar is autonomous intervention. Once we can detect and predict disease early, the next step is to act automatically. AI systems will adjust your sleep schedule, nutrition, and medication based on real-time biomarkers. Smart homes will detect respiratory issues through subtle changes in your breathing patterns. Clinical alerts will be triggered before you ever feel unwell. In this model, prevention becomes continuous, a background process that quietly protects you. But predictive medicine raises profound questions. Who controls your health data? How do we prevent algorithmic bias in risk prediction? What happens when AI knows your future vulnerabilities better than you do? And how do we balance early detection with the psychological burden of knowing what might happen? These challenges are real, but they are solvable. If we navigate them wisely, the outcome is extraordinary. A world where disease is intercepted at its earliest stages, where chronic conditions are managed before they manifest, where healthcare becomes proactive, personalized, and nearly invisible. A world where longevity increases, not because we treat illness better, but because we prevent it entirely. The end of disease won't arrive in a single breakthrough, but through 1,000 early detections that happen long before we ever need them.